Hello everyone, this is Dr. Aditya Gupta. I'm currently a DM resident in Pediatric Oncology at AIIMS Delhi. So in this video, I wanted to talk to everyone who will probably be appearing for an interview tomorrow or day after tomorrow as far as the Pediatric INI SS Pediatric Subspeciality interview round is concerned. Now, I just wanted to orient you to what an interview round entails and what you can expect as far as the interview round is concerned, and so that you're better prepared for it. For a lot of you, it will be probably the first time you'll be given an interview, especially for an entrance from an entrance point of view, right? So the interview round consists of three major parts. 10, 5, 5, that's the division how it is. 10 parts is a proper clinical case-based scenario. So when it used to be conducted offline, they would have given you a clinical case. 3 faculty used to come ask you questions related to that case and then give you marks. Now, in a current online format, so I gave my exam online only because of COVID, because of the COVID pandemic. Basically, all 3 faculties will have their each separate case scenarios. Most of the pediatric SS subspecialties have 3 faculties in them. So they will either the 3 faculties are going to give you 3 different case scenarios, or they're going to give you a single case scenarios, clinical case scenario, and they are going to ask you questions related to that. And each faculty will have 4, 3 plus 3. I think the HOD will probably usually has more marks, 4 or 5 marks they have, and the junior faculty have slightly lesser marks, or they can have equal marks. That really doesn't matter. What really you want to need to understand is that it's a proper clinical case-based scenario questions, which are like, obviously it's an online one, so they can't actually give you a case to examine and everything, but they will ask you what do you need to examine, what investigation will you need to do, how to approach that patient, or let's say the investigations come out to this, what's your diagnosis, what are your management things. Let's say the management, you are in a lower middle income group country, you're in an LMIC, these things are not available for management. What will you do? For example, I'll take the example of HUS. For HUS, atypical HUS, the drug of choice is the eculizumab, but eculizumab is not available in India, right? So you need to know the HUS guidelines in a developing country, which have been prepared by AIIMS professors. And that's how they come to their own research and their own, pet questions and then their own topics which they want to understand. Right. So this is how. So in my case, the 3 case scenarios that I was given were relapse in ALL along with counseling to an oncology patient, because counseling is a very important part as far as any oncology patient is concerned, because you have to counsel them. Getting a diagnosis of cancer is tough, right? I was asked about your neutropenic enterocolitis, and I was asked about approach to an adrenal mass. So these were the 3 case scenarios that I was given, broadly covering most things. In adrenal mass, I was asked about questions about neuroblastoma. I was about the trials in neuroblastoma. In relapse ALL, I was asked about the survival of different types of relapses, whether it is extramedullary or medullary and so on and so forth. In NEC, I was asked a recent question like, newer biomarkers as far as NEC is concerned. So this is the 10 marks. 5 marks are what is OSCE. Now, OSCE won't be, it obviously will be a bit tough to conduct the OSCE in an online method, but they have certain miscellaneous questions that they do end up asking. And in this miscellaneous question, one very important thing, which especially INI loves to ask, is biostatistics. Just brush up your basic biostatistics from your MBBS days and the ones that you use as far as your thesis is concerned. And in fact, they can ask you about your thesis as well and ask you to explain that biostats as well. And then 5 marks are as far as a departmental assessment is concerned. Now, as far as the departmental assessment is concerned, what they tend to ask in those 5 marks is, for example, I was appearing for a pediatric oncology seat, but I'm going to be working under the Department of Pediatrics, right? I have to coordinate with genetics, I have to coordinate with nephrology. Let's say the patient develops AKI, I have to coordinate with neurology. Let's say the patient has spinal cord compression. So these are the kind of questions that they end up asking. So in the genetics one, our divisional head of genetics, Professor Madhulika Kabra, she asked me about the genetics of retinoblastoma. So it was technically a genetics question, but it was related to oncology. In neurology, the professor asked me about the neurological side effects of L asparaginase. Basically, he wanted to go towards CSVT, cerebral, sinus venous thrombosis, a very common side effect of L asparaginase. He asked me about side effects of steroids. So he wanted me to go towards hypertensive encephalopathy and how to manage it and so on and so forth, right? Let's say you're preparing for pediatric neurology or pediatric critical care, and someone from oncology is taking, part of that interview. They will probably ask you about management of TLS. They will probably ask you about management of, if you're in peds, they will ask you about the management of approach to raised ICP occurring because of a mass, occurring because of an intracranial mass, or approach to a spinal cord compression, again, an oncological emergency, which requires pediatric neurology expertise. So that departmental assessment will basically consist of your own subspecialty question asked from a different subspecialty point of view. Okay, so irrespective of whichever subspecialty you are appearing, don't be scared about this department assessment. They will be that subspecialty focused question of your subspecialty. I hope you understood the point, right? Now, specifically, some pet question as far as biostats is concerned, because biostats either in the OSCE or even in the departmental assessment, they tend to ask. very favorite question. I think a lot of you who have already been must have. Please read this about. It's a very commonly asked. It was asked to me as well. My seniors have been asked this, and I'm pretty sure you will also be asked in some form or the other. What is the difference between a meta-analysis and a systematic review? All right. They love this question, and it's an important question as far as the understanding of biostats is concerned. They will ask you about sensitivity, specificity, negative predictive value, positive predictive value. They'll probably give you a test that is done as far as your own subspecialty is concerned and ask about its own sensitivity and specificity, accuracy of test. In meta-analysis, they tend to ask you what is the difference between funnel plot and forest plot. How do you decide upon different types of biases that are there? How do you design a trial? They can even ask you about your own thesis and then ask certain questions, biostats question related to that thesis. But remember, out of these 20 marks, around 3 to 5 marks will be related to biostats. So do brush up your biostats. They are not too tough a question, but they're not easy question as well. You need to brush up your biostats. So this is how the interview is formatted. The most important thing I want to tell you as far as the interview is concerned, that if you have no idea about any question, please be honest. They value honesty as well. Don't try to jump and say, I think I know. Don't be like the MBBS Vivas days. Sir, I just read it yesterday, but I'm not able to remember it today. Please don't do such kind of bullshit in front of those examiners. They are very, very experienced, obviously. Simply say, sir, I don't have any idea. Please, can we move on to the next question? They will appreciate your honesty. But if you do have certain idea, be confident. Whatever you know, do tell about that. It's fully possible they do end up giving you clues. They do give up clues to every aspirant. They understand the pressure in an interview situation. They understand the pressure. They give you certain clues for you to get to an answer. Even if you don't know the answer, if you think you are around the answer, you don't remember the exact answer, they will give you clues so that you can get to the entire answer. Remember, those examiners are your friends. Not exactly friends, but they are definitely your someones who are their well-wishers. They want you to get selected and they will give you scenarios in which they will be able to help you out as far as the interview is concerned. Don't think of them as someone who, the typical image of professors that we have who will be very dominating, will always try to push you down or something. Then absolutely unlike that. It's a very relaxed atmosphere. Don't be scared. Be confident. Answer. If you know the answer confidently. If you don't know the answer, say I don't know. If it's in the middle, whatever you know, say confidently. That confidence does reflect in the marks. All right. And one, some the pet topics that I told you about biostats. Apart from this, the one thing that you can definitely do is read up about your own thesis in MD in pediatrics. Definitely do that. Some questions somewhere will be related to your own thesis, or they will at least ask you, maybe not in a mark given manner, but they will certainly ask you something about your thesis. Right? So this is how the broad pattern of INI SS Pediatric Subspeciality interview is concerned. For those of you who don't know, that I'm currently working with DocTutorials, and we have a set of recorded videos along with a really good QBank and test series. If you're someone who is going to prepare for PES SS, NEET SS or INI SS for the next session, I would urge you that these videos are going to be really, really helpful. Those QBank and test series is going to be really, really helpful on DocTutorials. I'll give the link in the description. I'll give the link in the pinned comment section. You can buy them. They are now coming with they are reasonably priced as compared to other platforms. And I have personally made them. Divya has personally made them. All people who have cracked these entrances have made them. And they're going to be a really boost to your preparation as far as your INI SS or NEET SS journey is concerned. That's it from my side today. Thank you and have a nice day.